MedSurg 1 exam, read to you by Cliff Roperis. If the patient is sleeping on a sunken cushion and is being transferred to the bed, what is the nursing action? Replace or change the pillow? Replace or change the pillow? What is ABCDE? Allergy, bleeding, cortisol, diabetes, and embolism. ABCDE stands for allergy, bleeding, cortisol, diabetes, embolism. After giving a shower, a skin lesion is seen. What warrants you to make you decide to see a dermatologist? The answer is ABCDE. Again, this allergy, bleeding, cortisol, diabetes, embolism. Nurse is caring for a client with severe burn on both lower extremities. What is the percentage? One leg posterior plus anterior is 18%. For two legs, that will be 36%. Client is scheduled for an sclerotomy and wants to know what the procedure involves. Which of the following statement is appropriate for the nurse to make? Large surgical incision will be made in burned tissue or scar to improve circulation. Large surgical incision will be made in burned tissue or scar to improve circulation. Nurse is caring for a client who has a partial thickness and a full thickness burn on his head, neck, and chest. Which should the nurse recognize as priority? The answer is airway. The answer is airway. A nurse is contributing to the plan of care for a school-aged child who has moderate partial thickness burns on both lower extremities. Which of the following intervention should the nurse include? Allow the child to set her own schedule of care. Allow the child to set her own schedule of care. When examining the client's skin who has psoriasis, what should be the description? Skin patches and silvery scale. Client skin who has psoriasis will have skin patches and silvery scale. The nurse provides instruction to the mother of a child with impetigo regarding the application of the antibiotic ointment. The mother asks, when can she return to school? The answer, 48 hours after applying the ointment. 48 hours after applying the ointment. What is impetigo contagiosa? It's caused by Streptococci aureus or macules that develop into pustulant vesicles. It's caused by Streptococci aureus. A nurse is instructing a mother caring for a child who has impetigo contagiosa. Which of the following directions should the nurse plan to include? Wash the child's clothes in hot water. This is to kill bacteria. Wash the child's clothes in hot water. The nurse is making an initial assessment of a burn patient and the entire right arm, anterior and posterior, right anterior leg, and abdomen. What is the percentage of the burn? So you have arm is 9%, abdomen is 18%, and leg is 9%, total of 36%. So there will be two answers for 36%. A nurse plan of care for client child with burns in the upper torso. Which nursing diagnosis should take the highest priority? The answer is ineffective airway clearance related to edema of the respiratory passages. Ineffective airway clearance related to edema of the respiratory passages. The nurse is caring for a patient with partial and full thickness burns on 65% of the body. When planning nutritional interventions for this patient, what dietary choices should the nurse implement? The answer is high calorie and high protein food. High calorie and high protein food for better and faster recovery. A client arrives for initial evaluation following diagnosis of SLE or systemic lupus erythematosus. The nurse understands that which of the following is the indicator of SLE. The answer is butterfly rash. The answer is butterfly rash. The nurse is caring for a 35-year-old male patient with eczema. Which nursing interventions are appropriate for a patient with eczema? Systemic, and that is administer tepid bath and apply moisturizer. This is systemic and administer tepid bath and apply moisturizer. A nurse is caring for a patient who has burns to his face, ears, and eyelids. Which of the following is the priority finding to report to the provider? The answer is difficulty swallowing. The answer, difficulty swallowing. Nail disorder or paronychia. Which of the following signs and symptoms will the nurse document as data collection? Has to be SATA. Pain, infection of the nail, nail separated from the tissue, nail is soft and brittle. All of the above except nail is clear. So that's pain, infection of the nail, nail separated from the tissue, nail is soft and brittle. So everything else except nail is clear. The home health nurse assessing the skin lesions uses the PQRST. What does S stand for? The answer is severity. The answer, severity for S. The home health nurse noticed the whitish growth in the foot and of the patient who is suffering from diabetes. All of the following statements are true about tinea pedis, except it is treated by keeping the foot moist. So you got to choose everything except treated by keeping the foot moist. Your client treatment plan includes using the open method of burn wound management. It is most appropriate for the nurse to monitor a client being treated by the open method for which potential problem? Infection. The answer is infection. A client complains of burning pain on his lower thoracic area. What skin disorder would this usually be? The answer is herpes zoster. Herpes zoster is the answer. A nurse is caring for a client who has herpes zoster. What treatment do you give your patient? Aciclovir. For herpes zoster, give aciclovir. A nurse is contributing to the plan of care for a patient who has herpes zoster. Which of the following actions should the nurse recommend to include in the plan of care? Cover the infected area. Cover the infected area. Which of the following actions should the nurse include in the plan of care for the patient who has herpes zoster? Apply cold compress to the affected area. So you got to cover the infected area and apply cold compress to the affected area. What is atopic dermatitis? Which of the following findings should the nurse expect to see? We have eczema, rash, and thick skin. The answer is eczema, rash, and thick skin for atopic dermatitis. A nurse is reinforcing teaching with a 20-year-old patient who has atopic dermatitis. Which of the following information should the nurse include? The doctor might recommend an antihistamine to help control your symptoms. The doctor might recommend an antihistamine to help control your symptoms. The burn wound is periodically debrided using hydrotherapy. Which nursing intervention is essential either before or after therapeutic? Pain medication. The answer is pain medication. An assessment, a linear track from the epidermis to the dermis, is noted at the corner of the patient's foot. What do you call that? The answer is a fissure. Fissure, fissure. A nurse is caring for a client who has recurring herpes simplex type 1. The nurse should perform a focused assessment of which of the following areas of the client's body. The answer is mouth. Be big, mouth. A nurse is reinforcing teaching to a client who has herpes zoster. In what order should a nurse identify the typical occurrence of findings? This would be in the order of paresthesia, redness and swelling, appearance of vesicles, quipping blisters, crusted lesions. That's paresthesia, redness of swelling, appearance of vesicles, whipping blisters, and clustered lesions. Will be continued.